A beautiful afternoon to you. Many thanks for joining us on the program Healthy Living with yours sincerely, Oloije Oyihohai. Like I will always say every other day that we have the opportunity to be here on Healthy Living is to tell you that health is always better when you do take good care of yourself. Yes, do regular checkups and all of that. All right, so today on Healthy Living, we'll be looking at VVF, and that is vesicovaginal fistula, the causes, symptoms, and impact on women. Now, to do that with us is the person of Dr. Charles Unamure Wagbo. He is a consultant obstetrician and gynecologist, UBTH. Good afternoon, sir.
Yeah, thank you for having me.
All right, so about VVF, yes, according to estimates from the Nigerian Federal Ministry of Health, between 400,000 and 800,000 Nigerian women are currently living with vesicovaginal fistula, which is VVF, with reports suggesting around 20,000 new cases occurring annually. A significant portion of these cases remain untreated. Now, the key point about VVF in Nigeria right now is it is considered a high burden country for VVF, with an estimate placing the number of affected women, like we did say, to 400,000 and 800,000. And sure, moving forward, we have the case of untreated related cases, large portions around 90%. Now, most VVF cases in Nigeria are due to obstructed labor, and that's the reason why today we have a doctor who will be letting us in on all that has to do with VVF, the causes, the symptoms, and possible treatment. All right, so first off, what is VVF?
VVF is a type of urogenital fistula. And when we talk about fistula, it means an abnormal communication between two different cavities. In the female pelvis, you have the genital organs, that's the uterus, the vagina, and in front of the uterus, there is a bladder. The bladder is responsible for letting out urine, yes, while the genital organs is responsible for the reproduction for the woman. Yeah. If there should be no communication between these two organs, when there is now an abnormal, or what we call a fistulous tract leading to a communication between the bladder and the uterus or the vagina, then we'll call it a urogenital fistula. But in terms of VVF, VVF is a type of the urogenital fistula where there is a communication between the vagina and the bladder. So instead of the bladder letting out urine directly through the urethra, the woman starts leaking out urine through the vagina. And this has been noted to be a very great morbidity that can be associated with women. The thing about VVF is that the causes varies. In our own environment, the major cause of VVF has to do with obstetric conditions. Unlike in developed worlds, whereby majority of the VVF that they see is associated with surgeries. Hysterectomy, that the removal of the uterus, following cancer surgeries. But in our own setting, the major factor responsible for VVF is obstructed labor. And when we talk about obstructed labor, I would rather call it neglected labor. A labor that is probably not supervised by somebody that has been trained to proficiency to manage labor. So it's unable to recognize when there is a slow in the progress of labor or when there is a complete halt and you allow that labor to continue. What happens is that the head of the baby that's supposed to pass through the pelvis is unable to pass through. So it compresses the bladder, and that leads to pressure necrosis. And there cannot be sloughing of the bladder wall, and that can lead to a defect. The annoying part of this is that most times it's left unrecognized, and the patient is allowed to go on. And due to stigma, the patient is unfortunately unable to cry out or to seek for help at the right time. And then patient is left to herself and with other consequences. And I'm sure we'll discuss that as we progress.
Okay, now the symptoms of VVF and how it's been diagnosed. What are the symptoms?
Well, the major symptom of VVF is that the woman starts noticing that she's either incontinent. When I say she's incontinent, normally when you want to pass urine, you have the urge to pass urine. And just the way we are here now, if I have the urge to pass urine, I should be able to suppress it because I'm currently in the studio.
Sure.
But unfortunately for patients that are affected with VVF, they are incontinent. They are unable to hold urine. But instead of the urine now coming out from the urethra, they notice that it's coming out from the vagina, which is abnormal. And so because of that, there's a continuous leakage. This one is continuous incontinence. Unlike the incontinence that we usually see with urological issues, whereby it is intermittent. In this one, it is continuous because there is no sphincter to prevent the leakage of urine. So because that abnormal communication continues to leak urine, and the woman begins to smell. And we know how our people react to people that smell. The society neglects them, the family neglects them, the husband most times or their consort runs away. And the woman is left to fend for herself. She goes into depression, and only God knows if she will not end up taking her life.
So in all of these, is there no early detection in all of this?
In VVF, it can actually be detected very early.
Is it in the course of wanting, or in the course of giving birth, or after giving birth?
After giving birth, the woman has delivered, and she noticed that she's leaking urine because there is sloughing. It might be immediate or it might be delayed. But most times it might be immediate. Within 2-3 days, you notice that you're leaking urine. Then that patient should immediately present to the health facility to get appropriate and optimal care.
Okay, so in relating to woman stigmatization, now do we say women are being educated in order for them to know, okay, when I'm pregnant, this is the sign I ought to notice in order for me to raise alarm? So what are these signs that women ought to notice for them to raise an alarm?
I think in terms of education, we should be talking about empowerment of women. And I would rather want to talk about who are the women that are more at risk of developing VVF. Unfortunately, they are the downtrodden of the society. There are those that are poorly educated, those that are not financially capable
to go to good
health facilities, or those that, for one religious or cultural belief, you cannot go to the health facility without a man or accompanying you to the health facility. So most times they patronize, let me not use the word quack, I would say people that have not been trained to efficiency. And it is failure of the medical attention, or should I say the medical services rendered to the patient that usually results to the VVF. It is not due to the fault of the patient. Some of the, should I say, the habituals associated with patients with VVF, like sometimes you see very small women, women that are less than 1.5 meters, or those less than 5 feet. In this part of the world, we like using feet, so I would say less than 5 feet. Or women who are still in their teenage age. And we all know that when teenagers get pregnant, everybody stigmatizes them. So even the family most times sends them away. And by the time you send them away, you send them into the wrong hands. Instead, you should support them. After all, there's nobody that have not made any mistake in this world. Even the Bible says, those that have not sinned should be the first to cast the stone. So cater for them, take them to a health facility. But the question is, even when they come to the health facility, what is the attitude of the healthcare workers to these teenage pregnant women? It's just, did you come with your mother? And the lady runs away and fails to come back. Because most women that we develop VVF are those with contracted pelvis, small pelvis. Apart from those with short stature and those with very small pelvis, these teenagers, their pelvis is not matured to allow a baby to descend and be able to deliver vaginally. And don't forget, in this part of the world where we believe in the Hebrew women syndrome, and the Hebrew women syndrome is tagged as having a vaginal delivery. I rather say the Hebrew women syndrome is having a healthy baby to a healthy mother. But the religious part of it have done Hebrew women that you must have. I was listening to one religious program where the pastor was like, this year, all the women in this place must deliver like the Hebrew woman. No cesarean section. Cesarean section is not the first route for delivery. It's an alternative route. In that when the vaginal delivery is not possible or is not forthcoming, then you go for cesarean section. But when you now patronize the people that are aiming to deliver the women like the Hebrew women, they end up damaging the women. And the unfortunate part is that most times some of these women will die. It's the few that don't die that end up with VVF. And most times, the women that end up with VVF, because they have neglected obstructed labor, they end up also losing their babies.
True.
So she's depressed that she has lost her baby, and she's now further depressed that
there's a condition she has to fight with. Okay, now talking about the woman who gives birth through the vaginal and the one that gives birth through CS. Now, do you have a kind of a forum where you talk to women, talk to their mothers, the mother-in-law, their husband, to let them know that whether you're giving birth through the vaginal or you're giving birth through CS, the important thing is for you to have a healthy mother and a healthy child?
I would say in terms of talking to the general public, there are so many forums. This is one of them. But the question...
No, in your own little way in the hospital there.
Yes, like if you come to the F facility where we practice, there is the antenatal class. And this actually takes about an hour, 30 minutes before the doctors come in to see their clients. But the question is, what is the proportion of women in this state or in this city that will go to a refined health facility to attend antenatal? They rather go to the mama that they believe that, yes, she can always do it. So we need to change our psyche.
Yes.
We also need to change we also need to empower our women. Because the problem is that most of these women are dependent on their husbands. So when my wife needs to go to the antenatal clinic and I have to pay A to Z, I dictate where she goes and what she does. And unfortunately, it's the woman that carries the pregnancy. So who goes through the pain of pregnancy and the pain of labor? The woman. If there is a complication, who goes through it? The woman. And if anything goes wrong, who will be neglected? The woman. So we should concentrate on empowering the women so that they're able to make informed and the right choices in terms of seeking health care for themselves and their babies.
Okay, now it will surprise you to know that you find women talking, and a woman that goes through CS, she's not proud to tell us or her neighbor, oh, I went through the knife to get this child. And you find the other one who gave birth through the vaginal, now wanting to stand upright and say, yes, I did give birth through a normal process. I feel in your own little way, you should be able to talk to women or maybe the nurses to tell them you need not to stigmatize yourself. Either you're giving birth through the normal way or through CS. So is there a way you talk to your nurses to be able to talk to these women that comes for antenatal clinics?
All these are encompassed into the antenatal clinic curriculum that the nurses pass on to the women. But the issue is, majority of the women that will come to such health facilities are the empowered ones. In fact, these days we see women that that come to the clinic and opt for cesarean section ab initio. In fact, sometimes we have to discourage them to say, no, there is actually no clear indication for you to have a cesarean section. But the woman insists that, no, I don't think I can go through the pain. You offer them epidural and they say, no, I just want to have my baby. I want my baby to be healthy. But the ones that cannot access the health facility, what about them? That is why I think the concentration should be on equipping the primary health care centers to also function like the tertiary health center. But now we have so many gynecologists based in Benin City here. But go to the rural areas. How many specialists are based in the rural areas?
Okay. We're looking at the increase in the rate of VVF. So why is there no decline in all of this?
The fact that there is an increase in the rate of VVF, in fact, it is approximated at about 100,000 to 500,000 worldwide. Yet, Nigeria accounts for about 20,000. That's almost 20% of the increasing trend seen in the world. That tells us that we are not doing enough. We are not empowering our women enough. We are also not providing facilities to the hinterland. We should, if we have well-equipped primary health care facilities with well-trained doctors and even birth attendants that can easily identify when there is a problem and also be able to recognize where their own limitation lies so that they can refer appropriately. When there is a good referral system, most of these VVF cases will decline. And unfortunately for us, we thank God that the federal government currently is established VVF centers in multiple states. They just established one in Edo State here. And we are hoping that by the time they kick off, we'll be able to cater for the VVF for the VVF cases.
Yes.
But by the time we also look at the choice of location, how many VVF cases do we have in Benin City? Those people from outside Benin City, those in the rural areas where there is actually no means of transportation, will it be easy for them to access that facility within the city? These are questions that have been left unanswered. But we are hoping that the proliferation of the VVF centers in multiple centers will also help to reduce the incidence of VVF in the country. But in terms of reducing the increasing trend, we need to empower our women. We need to make girl-child education paramount in the budget of the country and the states. And if this is done and the women are empowered and the health facilities are well equipped, able to identify when there is a problem and be able to refer as soon as possible, to, in order to mitigate the possible consequences that would have happened, then the incidence of VVF would definitely go down. VVF was also a problem even in the Western world. But in the mid-20th century, it has been eliminated. That majority of the VVF, if not all the VVF in most of these countries, are now due to gynecological surgery and not due to obstetric conditions. And these ones are easy to identify and can easily be repaired, even intraoperatively.
Okay. Now, in all of these, is there a possible solution? Now, when we say a possible solution, where we find the woman becoming whole again?
It is possible. Because VVF,
at what stage is it possible?
VVF, if easily recognized, if quickly recognized, can be treated. It's not all cases of vesicovaginal fistula that should be treated surgically. Sometimes just leaving a catheter in there and allowing continuous drainage of the urine will allow for healing of that fistula, that the patient will not necessarily require VVF. So some VVF cases can be treated without any issues. But the problem is that late detection leads to more complications. And with more complications, the chances of having surgery is more. And if the surgery is also not done by somebody that is well trained, and it leads to a breakdown, we usually say that the first surgery is the best time to nip it at the bud. By the time it is missed and you have to go for a repeat surgery, it becomes more complex.
Okay, now let's look at social and cultural aspect. Now, what are the cultural and traditional practice that continue to, increase the rate of VVF in our country?
Well, we just talked about the Hebrew women syndrome.
Yeah.
I would rather tag that as a religious issue, whereby there's some religious people believe that if you don't deliver vaginally, that means it was not ordained by God. That we need to trash out. There is even an incident in one of the holy books where a woman died in labor. And what we are saying that no woman should die in labor, because the Lord said go and procreate. He didn't say go and procreate and die. So that means the baby should be alive, while the woman should also be alive. Then another thing we should look about is this issue of female genital mutilation, what we call female genital circumcision. Sorry, female circumcision. There is a type of female circumcision that they call the gishri cut, where an anterior incision is made in the vagina in order to narrow the vagina of the lady. And because the bladder is anterior to the vagina, if that cut is deep, you will make a nick into that bladder, and that can result to VVF. And then the poor innocent girl child is traumatized for life. So there are so many things we need to do. There are some good things about our culture, but there are also some negative things about it. And we should be able to trash the negative things and hold on to the positives.
Good one. Yeah. Okay, now before we go, let's look at public awareness. How far has the talk on VVF gone? How far has it gone?
Well, I would say many people are still not aware of VVF and its both the medical and the social issues related with it. Even though there is a World VVF Day, but the majority of the people are not even aware. By the time you're talking about VVF and you're telling the patient, oh, sorry, we need to go to theater because the baby is compressing on the bladder, and they're wondering why will urine be coming out. So I think we actually need to do more in terms of public enlightenment, both on the part of the health workers, the part of media organizations like yours, and even the government. And there should be focus, I will keep saying it, focus on the rural, less developed areas of the country. If all emphasis keep being on the cities and the towns, then we won't get it.
Go far.
VVF is a condition that can be totally eradicated. With good obstetric practice, incidence of VVF can be reduced to 0. And it is possible if we have a government that is willing and medical personnel that are well trained and evenly distributed all over the country and in order to mitigate these issues.
Okay, now you've spoken about governments. What's your advice to women, their husbands, their mothers, and their mother-in-laws? And also to the young lady watching us right now.
In terms of talking to the women, the mothers, mother-in-laws, but the first thing I say is that is a woman.
Yes.
Because
know your worth.
You know your worth. Like we always tell our patients, we have heard of what they call it. There's this trend now, is it baby mamas?
Yeah,
baby mamas, single mothers. But how many single fathers do we have? Is it that the men are not losing their wives? There are very few men that will lose their wife and stay single. So anything happens to that woman, the man picks another lady.
Yes, very well.
So the first thing is self-preservation. So forget about all the talks around you. Seek good medical advice, and by then we'll be able to make headway. By the time you keep listening to people, the person, they say, he who wears the shoe knows where it hurts.
It pinches.
So the woman should take off herself, put yourself first, because anything happens to you, it is the children that you are leaving behind that will suffer.
Okay, thank you so much, Dr. Charles. We say a big thank you to you. Like he did say, as a woman, know your worth, stand your ground, and you'll be able to tell anyone around you that this is a no-no for me. So I'll be seeing you again next week for another exciting time on Healthy Living. To have yourself a blessed day. Stay healthy.